Is a public health crisis, drug overdoses among teens. Today, OHSU hosted an expert panel to raise awareness about the dangers of fentanyl, a synthetic opioid that law enforcement and doctors say is causing a troubling spike in overdose deaths. Fox 12's Adrian Thomas was at the panel discussion and reports on the big takeaways.
This panel earlier today was essentially a call to action for parents to have an honest conversation with their kids. The medical experts say fentanyl is everywhere and it's 50 to 100 times stronger than heroin. All on the panel say if young people don't know what to look out for, they could all be at risk. In 2020, 18-year-old Cal Epstein, who grew up in Beaverton, tragically died from an overdose after he took what authorities said were fake Oxycontin pills laced with fentanyl. His parents, John and Jennifer Epstein, have now made it their mission to share their story so other families don't go through the pain of losing a child.
Cal had, all of the opportunities in front of him, and we had no idea that he was now a class of what I would say is high risk, which is being a teen with an internet connection because of the evolving drug landscape.
John and Jennifer now work with the organization Song for Charlie, which spreads awareness about the dangers of fentanyl and how easy young people can unknowingly purchase it from dealers on social media. They joined medical experts and school nurses on the panel at OHSU to discuss the dangers of the drug. One doctor says fentanyl was responsible for Oregon outpacing the rest of the country last year in overdose deaths.
In Oregon, we've had a 41% increase compared to a 16% increase nationally. And again, this adolescent group is so critical.
Addiction experts say fentanyl is typically disguised as painkillers such as Oxycontin or Percocet and also can be used to create false Xanax pills. Just a small amount can be deadly. The panel encourages parents and young people to stay vigilant and even prepare for the worst by picking up naloxone, sometimes known as Narcan, which can revive those who have overdosed on pills laced with fentanyl or other opiates.
In the state of Oregon, anyone can go to a pharmacy and ask for naloxone without a prescription, and as part of that, they will be trained by the pharmacist on how to administer naloxone.
And just to put in perspective of how bad of a problem this is, a study published in the Journal of the American Medical Association earlier this spring found drug overdoses among teens rose over 90% last year. A school nurse on the panel also said today that any young person should come forward if they see these kinds of pills out in their community or in their school, and they'll be met with support rather than discipline. In Portland, Adrian Thomas, Fox 12 Oregon.